Hi, this is Erica. I'm doing my abdominal and pelvic region assessment. I'm going to pay in the room for notes. Hope you're not getting dizzy like I am. Here's Sydney. We're going to be working with her today. And that should be good. Alright. First thing I would do is I would check the patient's chart, look for any history of any abdominal dysfunction if she's been in before for anything related. I would knock on the door, wash my hands, provide for privacy, and introduce myself to the patient. Hi, my name is Erica, and I'm going to be your nurse today.
Hi.
Can you state your full name and birthday, please?
Sydney Wiederman, 11/15/97.
And do you know what year it is?
2017.
Do you know why you're here?
Pelvic and abdomen exam, I think.
Perfect, yep. First thing I would do in this exam is I would just look for, inspect the patient, make sure that they're comfortable, that they have no obvious signs of distension or anything. She looks very comfortable and she's ready to rock and roll. So let's start with some subjective questioning. How would you like for me to address you today?
Sydney's fine.
Okay, Sydney, if you at any time feel uncomfortable or have any pain during this assessment, I need you to let me know.
Okay.
Are you in any pain currently?
No.
No? Have you had any surgery or trauma to your abdominal pelvic regions?
No, I have not.
Okay, any family history of diseases to that area?
No.
Do you have frequency urinating or pain with urination or any urinary changes lately when you void?
No.
Bowel habits as well, same thing. Any changes with them lately? Do you have nice formed BMs? Are they normal, regular for you?
They're regular for me.
Okay, once every day or so?
Yeah, once or twice every
Okay,
day.
perfect. Any recent diet changes for you? Taking any different vitamins, anything like that?
No.
Do you take any medications?
No, I do not.
Do you have any allergies?
Sulfa.
Sulfa? Do you, what happens when,
I
how do
just-
you know you have a sulfa allergy?
My body breaks out in a rash, but that's it.
Okay.
No stomach or no throat.
And that happened in the hospital?
Yeah.
So that wouldn't happen normally anywhere else
No.
besides a hospital setting?
Mhm.
Okay. I'll make sure that's on your chart. When you broke out in a rash, was it on your abdominal area?
No, just more on my arms and neck.
Okay.
So
Okay. Did they give you anything to...
they just took me off it.
Took you off it. Perfect. As far as your diet, let's go back to that. What do you eat 3 regular meals a day? Do you have any...
I try my best to eat 3 meals a day.
Okay. And do you have any pain when you eat specific foods?
No.
And you said no allergies,
No.
except for sulfa, so no food allergies. Do you smoke?
No, I do not.
Do you drink?
Nope.
And how much water would you say you consume a day?
Probably about 3 big bottles of it.
Okay, that's good. Does your urine have a color to it? What would you say the color of your
Like
urine
a
is?
light yellow. It's a little darker in the morning after I wake up.
Okay, any specific odor to it?
No.
No blood?
No.
And it doesn't hurt to urinate, good. When you bear down to have a BM, do you have any cramping, any hemorrhoids, any type of history of anything back there?
No.
Okay. Do you have a history of gallbladder, appendicitis, ulcers? Have you ever had a hernia?
No, I haven't.
No. So no abdominal cramping. How's your menstrual period?
Pretty normal.
Pretty normal. Once a month. And are you sexually active?
No.
Do you use contraceptives then?
Not currently.
Okay. And when did you first start your period?
I was 14.
Okay. Do you go to get your yearly pap smears then ever since then?
Yeah.
Okay. And nothing abnormal ever has come out in a pap smear for
No.
you? No abnormals. Okay. So do you take anything for cramps, or you just don't? You're lucky you
No,
don't get them. And is it a heavy flow or?
The first day is heavy, and then a couple days after that, it slows down. a bit.
Okay. So starts about the same time every month, and everything is good there. Okay, that's good. So no nighttime urination or any waking up during the night with any type of pains or anything like that. Okay, I think I'm going to start my inspection. I'm going to put you down just a little bit. Is there anything else you want to tell me or that you feel like you should that's pertinent to your stomach pelvic area?
No.
Okay. No traumas or surgeries?
No.
Okay. All right, first I'm just going to start by just inspecting, visually inspecting her belly. Her color is normal for her ethnicity, which is just a white. She's not warm. She is warm. She is not moist to the touch. She's got dry skin. Her umbilicus is midline, and she doesn't have any bulges or any lesions. She has no scars. She is the lower quadrant is lifting. Normally she's in no distress. I see no pulsations of any of her arteries. So yeah, there's no bulges or masses. So we're going to start right in with some auscultating. We're going to auscultate first for vowel sounds, so we can hear those before we start doing anything else. When I auscultate for vowel sounds, I'm going to start in the right lower quadrant. I'm going to listen in 3 spots in that quadrant. I'm going to move up to her upper left quadrant and over to her right upper, and then down to her right lower quadrant, in about 3 spots each. And I'm going to listen for it's like a low kind of gurgling sound, and that is vowel sounds of food and liquids moving through her bowels. If I can't auscultate a vowel sound, I would at least check for a full minute in that quadrant before knowing that we had to do something else. And and there was vowel sounds present in all 4 quadrants. Next, I'm going to also auscultate for her main arteries of the region. Going to start with her our aortic artery. Move down to her accessory, her organs. Move down to the other area right above her ribs to listen for the splenic arteries, and then I'm going to go down to her iliac and femoral arteries and listen for any bruise. And I'm going to start midline for the aortic artery and right in between where her ribs come together. It's not hip. It's not lifting or heaving. And moving down. Iliac artery, go by both sides, and plus 2 stations, no bruise. And her femoral, I would go underneath of her pants till about here. here. I'm listening for femoral artery right after the iliac crest separates. All right. We're going to now palpate in our quadrants, in all 4 quadrants. We're going to percuss first, and we're going to note we're going to want to hear some dull sounds over the liver and where the spleen is on the other side. The rest should be pretty tympanic. And two or three spots in each quadrant. So dull over the liver. As you're doing this, you're feeling if there's any lesions, masses, any nodules, any bladder distension, any type of nodule or mass. And if you do feel one of those, you want to ask the patient if they have any pain. When you're percussing any of the areas of where there's a mass, you want to make sure to document the size of the mass. If it is movable mass, if it feels hard or if it feels tender, that's what you would most definitely want to chart and get a consultant to figure out what was going on. So next I'm just going to palpate. And you can palpate for the same things that I was just saying, like kind of when you were percussing, you're just kind of feeling across the skin for any lumps and lesions and masses. The spleen, you can kind of go around the patient's side and you can kind of feel that it's around 8 centimeters right underneath kind of the rib cage. The liver is also, it's you can't really actually feel the contour of it, but you can feel that lower right side of the liver. When checking her pelvic area, when you bear down to use the bathroom, does it feel like your muscles down there are not working like they normally should? Do you have any masculitic bulges down there?
No.
Or any muscle weakness down in that area when you urinate or just bear down?
No.
No? If you did, there's Kegels, I'm sure you've heard about those. Those are exercises for strengthening the pelvic region for women. Also, you would just know and look when you inspect that region on a female that the hair is appropriately surrounding the area that it's supposed to be. And notice if there is any hair that is missing in a specific spot. That could mean that there's an issue there. Also, lumps, lesions, really a lot of subjective questioning, and if there was anything else, gynecological appointment would be appropriate at that point. So we have no issues, lesions, lumps, rash, anything like that in the pelvic area. If she was a male patient, I would ask her about prostate exams, if they have any prostate history in their cancer, testicular history in their cancer, if they're doing their testicular exams, self-exams. As far as self-care for women, when you shower daily, are you able to wash that region fine every day? And I mean, you also, as far as eating, you're able to get your groceries, so you can go drive, right? So you go to the store. So there isn't anything yourself can't do to take care of your eating, voiding, or woman parts, right?
Right.
So her self-care is great. Also, when you're looking at the males, you have to, also on a women, you don't really palpate when you're doing just a normal assessment, but on a male, you can palpate, kind of inspect and look at their testicular region for any testicular size differences, if they're swollen, if they have any, ask them if they've had any changes in that area, and then obviously you'd have, a consult would be put in for if they were having issues with voiding, urology, or and otherwise. All right, Sydney, is there anything else that you have any questions with anything else? We hit on everything today? Yeah, okay. Here's your call light. I would wash my hands and make sure her bed is down. All the safety precautions are in place, that her bed is locked. Make sure her bedside table is close to her. Wash my hands and exit the room. Thank you.